Good evening, Holyoke families and friends and community members. Thank you for being with me. Today is October 22nd. I am your proud superintendent, Dr. Alberto Vasquez Matos, who is with you to this evening to go over some key topics that are important to our community on behalf of our students. As a reminder, our Holyoke update went out today. There's important information that has gone out that I encourage families and community members to please take time to read. And today I've invited a guest who is going to talk to us around some important information as it relates to our school district, but also our community, our city, as it relates to COVID and all of the precautions, all of the programs that are being available to our families and our community, and also how do we prepare for the next couple of weeks. As you know, we've been monitoring the data that comes from the state to all of the cities throughout the Commonwealth. And as many of you are aware, in the last two reports, Holyoke is in the red. And so we plan accordingly, and we work very closely with the City Department of Health. So with me this evening, and I want to thank him and his colleague, Deb, from the Office of the Department of Health, who works very closely with me and my team. We meet weekly to go over data, cases, always their spirit is always what can we do in the best interest of our students and our families as well as the city. So I thank him for Sean to be with us today, this evening, to kind of talk to us. And then we will stop, and I'll, as we do all the time on Facebook Live, allow for some questions and answers, and then we will reconvene in the next Facebook live session. So join me in welcoming Sean and his colleague, and he will be speaking to us as it relates to the city efforts and COVID.
Hello, everyone. I'm Sean Gonsalves. I'm the director of the Board of Health here in Holyoke, and just here to speak to you about where we are as a community as it relates to case counts, and then also talk about some preventative measures that you can take, or some efforts or processes that you can go through to maybe lower your risk of contracting COVID, or if you have it, or if you're at risk for it, maybe lower the possibility of spreading it. So right now, Holyoke is in the red for the third consecutive week. Our average daily incidence rate per 100,000, that's the metric that's used to determine the color, either red or yellow or green, and we're at 12.7. And so that's a 2-week average, and essentially what it's doing is measuring how many people test positive per week, and it's a 2-week average of that based off of a population of 100,000. Now, Holyoke doesn't have 100,000 citizens. We only have about 40,000. So they do, an adjustment that you can multiply it to get to 100,000, and it rounds the numbers up. So 12.7, still in the red. Anything above 8 is considered red or high risk, but it is a slight improvement over last week when we were at 13.1. So our case count's a little bit lower, the average of these 2 weeks, and our percent positivity is at 2.5%, which is also a little bit lower. I would say that for Holyoke, being in the red is never a desirable place to be, and it does create sort of a need to make some difficult decisions. But I will say that the state's average rate is increasing week after week, and now the state's average incidence rate, that same metric, is at 9.2. So if the state was a city or a community in Massachusetts, the state itself would be in the red. And while not every community in Mass is in the red, many of the high density areas, a lot of the areas that have a lot of high population, those are the ones that are really struggling with case counts right now. So Some of the things that we're doing to help deal with that is we have the ongoing Stop the Spread test sites. There are two in Holyoke. There's one at 323 Appleton Street. It's open Mondays, Wednesdays, and Fridays from 2 p.m. to 6. And then we have the drive-through test site at HCC, and that is open Monday, Wednesday, Friday, Saturday, 7 a.m. to 11, and Tuesdays and Thursdays from 2 to 7 p.m. These are free to Mass residents. There's no insurance costs. You don't need an insurance card. You don't need money. If you live in Mass, you can go down there or walk to the walk-up site. They'll administer a test, and they'll send you the results within 4 days. You can go as many times as you like. You can bring your children. You can bring your family. They'll test anyone over a month old. And so when you're in a high-risk community, sometimes you can't avoid transmission. You can't avoid always getting sick. But one of the best ways to control the spread is early detection. So if you get tested once a week and you find out that you are ill, you can follow the procedures that we have in place. The Board of Health will call you, will walk you through the steps. But, finding out that you're sick, even if you don't feel sick, you can catch it early. You can limit the possibility of spreading it to coworkers or family. And to sort of transition there, one of our leading causes of spread in Holyoke is family transmission. So what's happening is someone is picking up COVID either at a daycare or at a friend's house or at work or at church, or it's very difficult to determine where the first person picks it up because you can't see it, you can't smell it, you can't taste it, you can't touch it. But they get sick. They may not know that they're sick. They come home and dad gives it to mom gives it to the kids, or in the other case, maybe a kid picks it up, he brings it home, he gives it to his parents or his brothers, and so one case spreads into 2 or 3 or 4 cases, and that's what's really pushing our case counts up. I would say just in the state and locally. So there are some things you can really do to minimize this risk, which is, one, avoid big gatherings. Avoid, this is a terrible time, unfortunately, for birthday parties, for weddings, for family gatherings, for big dinners, for parties, because when people are with their family, they feel very comfortable. They take their mask off, they get close, they're hugging, they're shaking hands, they're doing all the things that you know and love with your family. But unfortunately, when you're close with people, they can spread the virus, and they don't know that they're spreading it. And there's no, you're not any less likely to get the virus from a family member than you would be from a friend or from someone that you've never met. If you're close to somebody without a mask for an extended period of time and they're sick, even if they don't look sick, they don't feel sick, there's a chance that you're going to spread it. So, you'll hear on the news and you'll see from the CDC and you'll see from the Board of Health that we're really asking people, especially through the holidays, please don't have big parties. Please don't have big family gatherings right now, because we are seeing a rise in case counts and a rise in illnesses, and they're directly tied to family gatherings. And you don't have to feel sick or look sick to spread this. And a lot of people, they see their family members, they see their friends, and they say, oh, you look fine. And then they kind of let their guard down. Maybe they take their mask off. You go for a long car ride with somebody who looks fine, and you don't want to wear your mask in the car ride, but that closeness to somebody without a mask, even if they don't look sick, there's an increased chance that you could catch the virus and then possibly bring it home and bring it to work. So really stressing people to just please be careful. Think about traveling. Think about heading out to if you get invited to a Halloween party, and I know that sounds great, but those are a high-risk event. That's a possibility to spread, and so we don't want that to get into schools. And the best way to keep it out of the schools is to keep it out of your home. And so, just please be mindful. Some of the other ways you can prevent, transmission is to keep your immune system up. So right now we have flu clinics. They're free as long as you have some form of insurance. Mass Health definitely covers it. And those are at HCC. Like I said, they're open to the public. They're in partnership with CVS. And we have one on November 3rd and November 6th. We have a flyer that we'll provide to, Dr. V in the school to circulate. but you can bring your children, you can bring yourself, you can get a free vaccination. And while the flu vaccine doesn't necessarily protect you from COVID, what it does is it keeps your immune system. If you don't have the flu, your immune system is a little bit more robust, more strong, and you're more likely to be able to resist coming down with the virus. If you're already sick with the flu, a lot of what we saw at the peak of the pandemic is that people were sick with the flu and their immune system was a little run down, and that increased their likelihood of catching, other illnesses, including COVID. So you want to stay strong. We have these vaccines. They're from CVS. You can get them directly at CVS, or you can come on down. We'll be distributing some educational materials, and we have a ton of free masks to give out. So, if you're a Holyoke resident and you want to come on down and get a vaccine, we got them. Debbie, did you want to add anything?
Hi, good afternoon. My name is Debbie. I'm from the Holyoke Board of Health and I'm the public health nurse. For many years, I was a school nurse. I worked at Peck School and Holyoke High School, so I know what it's like to work in the school system. Speaking of that, I work directly with Cynthia Carbone, who is the nursing school administrator director for these school nurses, and we speak almost every day. So if there are cases of children that are either working from home, or if there happens to be a case in the schools, we work very closely to try to monitor that student and monitor the families. Also, in collaboration with the Holyoke Board of Health and the Holyoke Public Schools are what are called CTC, Community Tracing Collaborative. If you do not get a call from us, you may get a call from the CTC. That's all we are trying to do, is to stop the spread of the coronavirus. We will try to obtain information on your family, simple information. We don't need financial, we don't need any of that. That's all we would like to know, is who's in your family so that we can prevent the spread of this, who your contacts were. Try not to be, the word is, I guess, naive, to think that if you're going over somebody's house and you happen to know them very well, they too could have been over somebody else's house. So therefore, that's how this spread keeps occurring. So I want to just try to reassure you that when Community Tracing Collaborative calls you, that's all they want to do, is to get your family, if it's a mother, a father, a sister, brother, a grandmother, whoever lives in the house, that's all we need is their name. We get their date of birth. We find out if they work, because if they're in contact with somebody, we don't want you to go to work. We don't want to spread it to your employer. We also give you resources of how to take care of yourself. If there's shopping that needs to be done. These people have been hired by the governor, and they are there for your benefit. They want to help you. They want to help our community, especially, get through this COVID crisis. And that's what we're all about right here. It's community. We're not out to, like I said, we don't need financial. We need nothing about that. We, as a Holyoke community, and I've been living in Holyoke over 60 years. I've been here all my life. We want to be a better community, and that's what this is about. Thank you.
So now, as always, if there are any questions, we'll take questions as it relates to the information. A lot of this information was also is shared in your weekly updates, so please take time to look at the important information with flyers as it relates to ride sharing, safety during Halloween and other holidays, as well as the sites and the times for the free flu clinics, as well as the COVID testing sites. So I'll take any questions for me or my colleagues from the City Department of Health. Okay, so I see no questions coming in. So please, once again, check out the important dates, upcoming dates for the next couple of weeks, as well as all of the safety information that I've included from the Department of Health, as well as some reminders. And so I want to wish everyone a great rest of the week. Please stay safe and healthy. And I look forward to talking to you more. Once again, please reach out to me or any of my staff members if you have any follow-up questions as it relates to our educational program or additional clarifications as it relates to safety or anything related to what we're doing to prevent the spread of COVID in this city and in our district. So have a wonderful evening and a wonderful weekend.